When women look in the mirror, not all are happy with the assets they were born with. One area that seems to cause the most discontent is breast size, which has many women seeking a breast augmentation. Making that decision is not one to be taken lightly, nor should you select your medical team lightly. The surgeons at Columbus Aesthetic and Plastic Surgery take pride in helping women achieve the best appearance for their body's overall aesthetics. Joining me with more is Dr. John Wakelin. Doctor, nice to have you here.
Thank you for having me.
We are talking about breast augmentation. Many people want it. Who's the best candidate? Who's a good candidate for something like that?
Well, candidates for breast augmentation really run the gamut. Sometimes they're young people. I certainly want them to be in adulthood. But really we do breast augmentation really for people even up into their 60s at times. Typically it's somebody who feels that they would like to fill out their clothing a little bit more. Many times it's women that have had children and have found that after having children, they've lost a lot of volume and maybe they just want to be back where they were before. It really runs a wide gamut beyond the sort of stereotypes that a lot of people think about.
Right, so there's not one person. If you are uncomfortable or self-conscious and you want to make a change, then it's possible it's for you.
Absolutely, and just exploring that option is a good way for most people to do that, get the information, and then make the decisions from there.
We're coming up on bathing suit season, and so that all of a sudden starts people thinking about it. When is a better time to have this type of surgery in order that you have time to heal, especially if you plan to wear, you know, your bathing suit and summer clothing?
Well, the great thing about this procedure is for most women, the downtime is very short. I typically am very busy on Thursdays, and breast augmentation is a very common procedure that I do on Thursdays. In most cases, my patients are back to work on Monday.
Are they really?
Yeah, so while certainly there's some discomfort involved and there's some downtime, the recovery is fairly quick for most patients, with some exceptions. But you know, being able to be in a bathing suit and swimming and those types of things, usually you're able to do that in a month or so.
Oh wow, that is pretty quick.
Yeah.
Implants, there are different kinds. Can you sort of describe them and say, you know, which might be better for some people than others?
Yeah, so breast augmentation has really come a long way, and the implant technology has come a long way since the mid-1950s when the surgery began. Right now we have a variety of different implant shapes, sizes. There are saline implants, there are silicone implants, and there are even a couple of different options within the silicone implants. And so what this allows us to do is really focus on each individual patient, their anatomy, their goals, and try to pick the best possible implant for them.
And if you have an implant at a younger age, how long will it last? Is it possible that you'd have to get another one?
Yeah, certainly, it's about 100% that at some point in your life you'll probably need a replacement of your breast implants because they're not lifetime devices, just like any other device that we implant into the body, like a knee replacement. So what I tell most of my patients is we hope that you're going to get 15 or 20 years out of your implants. We know that there's a small rupture rate every year, beginning the first year, but at the same time, just a few weeks ago, I removed a pair of implants and replaced them for a woman that had had them for over 40 years.
Oh my golly.
Which is not typical at all.
Right, not typical. Still, knowing going into it that this might be a possibility.
I tell my patients, plan on perhaps 15 years and maybe a little bit longer, but at some point, plan on getting them replaced.
And when you walk a woman through the consultation, and I know you all do that very well, doctor, do you talk to them too about size and what should be a size to go with the rest of their body? I mean, how much do you let that patient decide how big of an implant they get?
Every surgeon's a little bit different. I let my patients decide a lot and have a tremendous amount of input. In fact, my patients choose their size with some guidance from me. I spend a lot of time speaking with our patients, and we actually have them try on implants. There are lots of different ways to determine breast implant sizing, including some computer imaging and those types of things. I've tried that as well. I still think that there's no substitute for literally standing in front of the mirror and looking in the mirror to determine which size you want to be, because that's really what counts. I tell people I can't guarantee what size bra you're going to be wearing after the procedure, but what really matters is what you feel like when you look in the mirror, not what the tag on the bra says.
And it's a personal decision, like
Absolutely
it is
it
for
is.
them. Well, we've had your information on screen, doctor, so we appreciate the advice. Thank you very much.
Thank you.